Hi, this is Dr. Benny Shao, and this is an introductory video regarding our eye exams for the patient with sensory processing disorders of some type. So sensory processing disorders are a group of disorders with various different causes that have something in common, namely the sufferer easily gets sensory overload of some type. This will have many different types of causes, environmental, infection, toxicity, genetics, etc. Usually there's some type of stressor that induces a stress response in the brain, which results in some type of fight, flight, or freeze response. And this stress response will include a variety of different sensory sensitivities involving various senses that include vision, touch, hearing, balance, and even taste. The response will usually affect emotional regulation as well, and all of these are symptoms of dysregulation in the patient's subconscious or autonomic nervous system. So let's talk about what happens. Essentially, in those with this type of disorder, the brain is stuck in some type of stress response, fight, flight, or freeze. They will experience heightened sensitivities to certain types of sensory input. They'll have a reduction in the ability to process big picture and detailed information at the same time, which tends to lead to a lot of poor organization skills. They will tend to have a reduction in clarity of thought because of the aforementioned emotional instability. And as a result of these disruptions, a lot of their gross and fine motor skills will be underdeveloped. So let's answer the question, how does an eye exam help this? Well, the eyes are quite literally part of the brain, and by assessing the ability of the eyes to work together and by measuring the accuracy of tracking and accuracy of focus, we can determine what type of stress response the patient is experiencing, as well as measure the severity of that stress response. And so through a binocular vision exam, we can determine the patient's ability to process global visual awareness relative to detailed discernment. And when it comes to patients with sensory processing problems, they often have trouble with both. As a neurodevelopmental optometrist specializing in vision therapy, my job is usually to improve on a patient's fine motor visual skills. However, in the presence of a sensory processing disorder, the patient is so dysregulated that you simply cannot train them unless the sensory processing problem is first dealt with. I can't train a patient with ADHD to visually track better if he's so dysregulated that he can't even sit still, much less keep his head still while following a moving target. We simply cannot build visual skills in the absence of attention. Therefore, we always recommend that we regulate the nervous system first by using syntonic phototherapy and OMST, which stands for Optometric Multisensory Training. For more information about how this works, please look at the link below in the video description about syntonic phototherapy. So syntonic phototherapy is a type of light therapy that serves to regulate and stimulate the workings of the subconscious nervous system, something that is very important to those with the dysregulation that occurs in sensory processing disorders. OMST, Optometric Multisensory Training, can be considered Syntonics on steroids. It's a protocol that we use to train the brain to simultaneously take in and integrate visual, auditory, tactile, and vestibular information at the same time by doing the syntonic light therapy while laying down on a moving bed with a weighted blanket while listening to music that randomly fluctuates in volume. This serves to decrease sensory hypersensitivity and improves focus and attention and even improves emotional regulation. It's a 12 consecutive day in-office program followed by 18 days of in-home light therapy. Typically, after these 30 days of treatment, we would re-evaluate the patient 2 months later and then determine how much vision therapy is necessary after that, depending on the type of problems that they're having. At that point, the patient is expected to have improved in their emotional and sensory regulation so that conventional vision therapy is now actually possible. For more information, please visit www.omst4brains.com. And again, please watch our video called Intro to Syntonics. Thank you very much, and we look forward to seeing you soon.